Thank you very much, Alexander, for inviting me for the people of Europe. This wonderful topic you have selected. So I'm so glad to address this very useful topic, especially for women, because women usually they are complaining most of the time the backache. So they are having back pain. It's a common issue we face in our clinics. So, so I'm glad that we have chosen this topic. So now coming to the participants, I hope the participants of last time, they are also there, and now there will be more participants in the future, and we will come up with a lot more topics to cover. Just a second, it's asking which language I'm speaking. I'm speaking English. Okay. So now I think we know each other. At least you know me. I know some of you, but slowly we will know each other. So the topic is very interesting. We are talking about joints here. The joints in the body, they are very, very important part because we always want to move. And if we have some issues in our joint, that's really, really affects our life very badly. So it is very important to take care of the joints. We are Ayurveda followers, we are Ayurveda lovers, and Ayurveda tells us that we can live for 100 years without any health issues. God has made this machinery to last for 100 years without any health issues. So if you take care of your health, if you maintain your health, if you take care of your body, what the fuel you are consuming, what diet you are taking in, and how much sleep you are taking, and all these things, and how much stress you are taking, all these factors, they affect your life and health. So it is very important to follow the principles of Ayurveda. The first and the foremost thing to maintain joint health is maintain your weight. If your weight is normal, then you are less likely to be affected by joint pains. Secondly, other than weight, if your posture is good, nowadays people are sitting over computers, people are sitting all the time on the couches, on this these chairs in the office, but usually our joints they face all the problems, all the pressure, and so always take care of your posture. That is another factor which can cause joint issues. Third point is nutrition. Usually people don't eat healthy food, a lot of alcohol, a lot of heavy, cheesy, and greasy food, which is not healthy. Less salads, less oils, less, I would say, by oils, I mean omega 3s, seeds, walnuts, nuts, such oils should be consumed rather than saturated oils. So all these things they take a toll on joint health. Our joints, we have about the joint structure is like this. All the joints, most of the joints, they in between the two bones, there is usually a fluid. That fluid is called synovial fluid, that liquid. So joints are moving against each other and they are rubbing against each other. And to prevent any injury, there is some fluid and increase the mobility. There is a fluid called synovial fluid. In every small joint or the big joint, on the pressure joints like knee joints or hip joint, the hip joint is like this. So all the joints, they have inside there is some liquid. In the vertebral column of the back, the joints are like this. So one above the other, the vertebrae are like this. So in between the vertebrae also there is a sheath called this this vertebral sheath or the disc. So in the disc is also having that liquid that is called synovial fluid. So our vertebral column having synovial fluids, our knee joints having synovial fluid, our shoulder joint and our hip joint all having this fluid. So if we are pushing too much, if we are obese and if we are not following correct posture, the two bones they are crushing against each other and they are damaging the fluid or the sheath or the disc in between the joints, and that is causing the wear and tear and the rupture of the disc or the slipping of the disc or damage to the disc or inflammation of the disc and oozing out of that liquid out from that sheath, and um, that leads to edema, swelling, pain, inflammation. So too much exercise, too much running with heavy weight is also not good for the knees. If you are not used to running and if your body weight is very high, so you should not run. You should rather do some cycling or swimming or some physical exercises which are not putting pressure on the knee joints. So let's focus on the first slide. The first slide is focusing on three main joints which are very essential for our mobility. Number one is knee joint, hip joint, and the shoulder joint. So although the cervical or the spine is also very important, but with the knees, healthy knees, you can walk, you can run, you can move, and with shoulder, healthy shoulder, you can catch things and do your daily work. So there are so many diseases and other health issues which can affect the joint health. So let's see what we can do to improve our joint health and mobility. Next slide, please. Yes. So poor joint health is the commonest issue which is affecting the whole world. As I told you, with the passage of time, the new inventions and discoveries for to ease out our human life, we have discovered comfortable living. We are not walking, we are going by car, we are just lying on a comfortable couch, and that is affecting our posture. And due to a lot of stress of work, we are sitting on the chairs throughout the day. So it is very important to take a break from the sitting posture and just do some stretching whenever you get time. And always sit straight. So for that you need energy. For that energy you need good nutrition. So it is very important to eat healthy food rather than eating unhealthy food. So you should always be able to sit straight. If you are sitting like this, that means your body is not having enough energy and you are not eating right. So you should ask yourself whether I am able to sit straight for how many minutes or how many hours. That means you are eating good and your body is fit. And also take some breaks. Next slides, please. So, as we are discussing, obesity is number one cause. Because of the overweight, there is too much burden on the hip joints, on the vertebral column, on the knee joints. Trauma can also cause inflammation in the joints, some inflammation. Whenever there is injury, that can be destruction of the joint space. And there can be infections. Sometimes there are certain infections, osteomyelitis also, some other infections which can affect the joint health. Deficiency of vitamins and minerals, calcium, phosphorus, and also other vitamins like vitamin D. We are ignoring vitamin D very much, but vitamin D is very much important for our joint health as well as for our bone health. Vitamin D is also called sunshine vitamin, and it is very essential. People are consuming in Europe a lot of vitamin D pills. So, but still, I would recommend at least mm, take if there is sun. I know there are so many places in Russia and northern hemisphere where sun is very little, but still, whenever you get time, because vitamin D can be stored in the body, and just 15 minutes or 10 minutes of exposure, especially of the white skin. White people, they have a privilege. They get this vitamin D very quickly in the body. So it can be stored just 10 minutes every day. it will generate about 500 units of vitamin D in your body. So our body needs 500 IU of vitamin D every day. So if you are lying in the sun for a weekend, so you are generating enough vitamin D which will last for 1 month. So that's why you should have sun bath once in a month, or every 15 days, or once in a month, at least 2 3 days uh, time. And then in menopause also there is deficiency of some hormones like estrogen, because estrogen is responsible for depositing the calcium and the phosphorus in the bones. And when the menopause happens, the levels of estrogens, they decrease, and then the calcium is not deposited properly in the bones. So the best way is to exercise again, exercise and nutrition and good sleep. So this is another cause of, especially in women, they get after menopause. There is a lot of chance that their joints, they will get damaged. So it is very important for them to exercise, especially to all the women. I always tell them to exercise between 30 to 40 years of age, because that is the time when they are full of energy and they have their youth and they have power. So they must do strong exercises during, especially during 30 and 40. Although it make a habit right from the childhood, we should eat healthy food. But if you missed it, still you can control it between the period of 30 to 50 also. So it is not gone. Even if you are nearing 50, you can still start exercise. You can start in any time of your life. So, but it is still better if you start early. And there can be other metabolic diseases, complicated disorders, certain diseases like autoimmune disorders, so many other diseases. But these things can be controlled by Ayurvedic herbs and also healthy lifestyle. Next slide, please. So major issues of the joints are osteoarthritis, rheumatoid arthritis, and gout. Osteoarthritis, whenever I say the word arthritis, whenever I say itis means inflammation. So whenever there is itis anywhere in the body, for example, conjunctivitis, rhinitis, sinusitis, dermatitis, or tonsillitis, anywhere, wherever there is itis, it means inflammation. So osteo means bones. So whenever there is inflammation in between the bones, there is damage to the joints. It is called osteoarthritis. Most commonly, it affects our knee joints. And the surgeons, they are just making world records by recommending knee replacement surgery to everybody. So in India, they are making world records because there is a lot of population, a lot of people, they are suffering from osteoarthritis. India and USA, they have the similar kind of eating habits nowadays. Previously in India, it was very traditional, but nowadays, Indians, they are becoming the diabetes capital of the world. Indians are becoming very obese also. They are consuming continental food, American food, fast food, junk food, as well as Indian food. So Indians are becoming fatty nowadays and getting osteoarthritis, and a lot of doctors, they are making world records on knee replacements. So they don't guide the patient to exercise. They don't tell the patients that they can reverse this problem. It is possible that they can prevent this knee replacement by exercises as well as some Ayurvedic herbs and nutritional supplements. So another disease which is very much common in women, especially in the middle age, between 30 to 45, this rheumatoid arthritis is mainly affecting the ladies, middle-aged lady, when especially after the birth of the children, when they don't take care of their postnatal care is not properly done. In Ayurveda, it is tradition that whenever a birth takes place, the woman should not sit in air-conditioned room. The woman should take care of balancing the vata, or not consume cold drinks, not consume stale or food which is not healthy, and also not consume cold water or cold drinks. But in Europe, people, they don't know these traditional things. In India, the incidence of rheumatoid arthritis among women is very, very less. In Ayurveda, it is mentioned that after the birth of a baby, there are chances that the woman can get the imbalance of Vata. According to Ayurveda, this Vata, Pitta, Kapha, these are three energies of the bodies. If these get imbalanced, then there can be diseases. So the women after the birth, they are very weak and their joints are very prone to get this rheumatoid arthritis. So even after 5 years or 10 years of giving birth to a baby, they can develop this rheumatoid arthritis because at the time of the birth, uh, proper care was not taken. Even in Ayurveda, it is always mentioned to massage the woman with the anti-vata oils, with the sesame oil or medicated oils like Dhanvantram oil, and also take shower with very hot water. Even in summers in India, it is scorching heat, like 45 degrees centigrade. But still, the women, they are not guided to sit in air conditioner, and they are asked to take shower with hot water and also drink some ancient wines called aswa and rista. So ancient wines made from various Ayurvedic herbs and processed naturally, they are being fed, like especially Dashmula Ristam. Dashmula Ristam is a very ancient wine prepared like 3,000 years ago, 2,000 years ago. And those wines, they are given to the women. The alcohol content is like 7 to 10%. They are prepared just like ordinary wines. So this way, the vata gets balanced, and they are fed with the certain foods which are containing a lot of cashews and nuts and flaxseed and all such sesame seeds, so which are warming and heating in body, and they are not causing the imbalance of the vata. So this way, this autoimmune disorder, it can be prevented, and you can see the incidence of rheumatoid arthritis is too high in Europe and too high in Western culture, not in India, because in India they follow these diet patterns of Vata, Pitta, and Kapha and lifestyle. And the third one is gout. Gout is caused by too much consumption of proteins, especially beef, pork, and wine, alcohol, and sedentary lifestyle. So gout is usually affecting the men who are not active, who are not exercising, not drinking enough water, drinking enough alcohol, too much alcohol, and also consuming a lot of proteins. So it is imbalance of pitta. So osteoarthritis is imbalance of vata, gout imbalance of vata and pitta, and rheumatoid arthritis is vata kapha and also with ama. So next slide, please. So another problem with the spinal joints is cervical spondylosis and lumbar spondylitis. Basically, the spine, as I told you, is like 33 vertebrae, pieces of bones put together, one above the other. So in between the vertebra, there is space that is called intervertebral space. And in between the space, there is a disc, which is a soft tissue containing some liquid. So the disc, if we put too much pressure and our posture is not correct, and it bends, the spine bends incorrectly and stays in a bended position for long hours while sitting on chairs or while sitting on sofa watching TV, it can cause slip disc. Or if we are not strong enough, our back muscles, they are not strong enough, and if we carry or if we are pulling some heavy objects like heavy tables or carrying some heavy things and muscles are not strong, then the disc can prolapse and then we end up in a hospital and we go for the surgery. So these are the things which can be prevented. Sometimes these injuries, they are minor, and then they can cause long-term pain in the back. And sometimes they are very, very mild, only related to the muscles, and which is mainly all the most of the women, they are suffering back pain. In those cases, mild back pain or back moderate back pain is caused by muscles, and the bone involvement is very less. The disc involvement is very little, but still, commonly the women, they suffer from back pain. They have the muscular pains. So, giving because the muscles, they get stressed and in spasm, they are all the time stiff because they are sitting too much, they are in the wrong posture and not relaxing the muscle. So that muscle is becomes stiff, and that leads to lower back pain, especially in the morning time when the woman gets up from the bed, and then the muscles are in spasm, and then they complain of back pain. So that is also one of the cause, muscle spasm of the back. Next, please. And then there is osteoporosis. As I was telling you, vitamin D and calcium intake is very important. So I'm not saying that you stop these vitamin D supplements. You can, as long as you are checking them and they are healthy levels in your blood. So you can take vitamin D supplements also. But exercise is very important because vitamin D is just a carrier. It is carrying calcium from your digestive system when you eat calcium, and the vitamin D will catch it from the gut, from your intestines after it is absorbed and digested. Then it will take this vitamin D. This vitamin D will take the calcium to the bone, and if you are not exercising, the bone is not hungry. So if you are exercising, the bone is hungry for calcium. If you are not exercising, the bone is not hungry for calcium. So the bone does not take calcium from the vitamin D, which it is bringing. So it is very important to understand the whole cycle, the role of sunlight, the role of exercise, the role of consuming calcium in the diet. So it is all important to prevent osteoporosis. Sometimes people just rely on only on vitamin D supplements. They don't take enough calcium. They don't do exercise, so they still get osteoporosis. And sometimes the calcium is deposited on the heel, so that leads to this spur, this calcium spurs, or the excessive deposition of calcium at one point, leading to the pain in this area, heel area. Next slide. So there are other problems like similar to rheumatoid arthritis. This is ankylosing spondylitis, when the spine becomes like bamboo and it's very stiff and the patient cannot move. It is mainly affecting the men, the middle-aged men. So it is also autoimmune, like full of ama because of faulty diet which they consume. And the frozen shoulder is also called capsulitis. The capsule of the shoulder, it is somehow it is inflamed and it is not allowing the joint to move. So it is very important to give some massage with various oils, and also ease the movement, slowly exercising, and then the frozen shoulder, and give some anti-inflammatory Ayurvedic herbs like turmeric or ginger every day, and give warmth to this area, and it will help. And fibromyalgia is not actually a disease of joints, but it is affecting the mobility. Especially, it is affecting the woman mainly, between 20 to 50, 20 to 45 age women. They are affected by fibromyalgia when there is too much pain in the body, and the body is, the patient doesn't know why there is pain, and the doctors are also seeing all the tests are normal, everything is normal, x-rays and all the tests are normal, but still the body is complaining of pain. The patient is suffering. So this can also be relieved in Ayurveda. So the next is sciatica. Sciatica is a pain when the nerve which is coming out from the lumbar vertebrae and going out in the knees, in the ankles, and it is compressed. That nerve is stuck in between two vertebrae columns, L4 and S1, L4, 5, and S1. So this compression or this pressure on the nerve causes severe pain, crippling the person, and the patient is not able to walk, and it's severely painful and restricted. The patient is restricted to bed. But still, Ayurveda can help a lot in all these health conditions affecting the joints. Next, please. So, in now coming to different conditions in osteoarthritis, as we discussed, that there is stiffness and pain and swelling, and pain increases after physical activity. So, it is not recommended to run in osteoarthritis because the space is already reduced. So you cannot walk long distances, you cannot walk stairs, climb stairs, you cannot run. So it is better to do cycling or swimming if you are suffering from knee osteoarthritis. Cycling and swimming can strengthen your quadriceps muscles, it can strengthen your muscles around the knee joint. Various massages are good. There is a procedure in Ayurveda, it is called Janu Basti or Panchkarma procedure, which is called Janu Basti. So, Janu Basti is very, very useful for osteoarthritis and helps to restore the joint space as well, and also helps to prevent knee replacement in many cases. It is also very important to reduce the weight and take care of your diet, as I told you, and take care of your vitamin D levels. According to Ayurveda, it is called Sandhivata. Sandhi means joint. Vata means the Vata energy of the universe, or the kinetic energy, or the air element of the universe. So Sandhivata, whenever there is air, there is dryness of the joint space. The disc, the synovial fluid inside the joint is dried up. So if something is dried up, if the fluid is dried up, what we do, we put some oil. So we do Janubasti. We create a barrier of with some flour, gram flour. We put some oil in that on the knee joint to lubricate the knee joint. The procedure is done for like 21 days or 1 month, and the joint becomes new. And then you can run again. I mean, not run, but at least you can live a comfortable life. Next, rheumatoid arthritis. This is a crippling disease, and I am surprised with Ayurvedic results in this disease. There was a lady; her hand was also crippled. These two fingers they have developed the deformity. They were crippled, and with the passage of time, with Ayurvedic medicines, I'm talking about my patients in a country called Macedonia. I am practicing in North Macedonia also. I have a Planet Ayurveda center there. So there are every day there are patients coming from different countries there. Whenever I go there, or my junior doctors, I have a team of doctors. So the junior doctors I'm sending there now. So they are seeing a lot of patients, and this lady who used to come to me was crippled, and after 3, 4 years, 5 years, it straightened up. And even being a doctor, I also assumed that how it is possible. But slowly, slowly, she was surprised. We were also surprised that everything was reversible. Although relief of pain and symptoms and getting rid of this disease is very common in Ayurveda. I see every day so many patients. They are getting free from this disease and pain. But straightening of these crippled fingers was really a miracle. So it is called Amavata in Ayurveda. Usually, the woman in the middle age, they are affected. The main symptom is the stiffness in the morning time, especially the small joints of the hand or the fingers. They are affected, and it is affecting the middle-aged woman. Morning stiffness is the main joint, the main symptom. It can be reversed by using very simple spices like turmeric, ginger, and simple herbal teas like that. Next, please. Okay, so this is next one is gout. Gout is usually affecting the men, and the big toe is affect. Big toe causes uh, there is a severe pain in the big toe. This is the main symptom. Whenever some men, middle-aged men comes to our clinic and complains that I have pain in the big toe and it is red and inflamed, we immediately see and we understand it is high uric acid, because the uric acid crystals they are deposited in the joints. Why this happens? Because of, again, no exercise, too much consumption of carbohydrates and proteins and alcohol, and then leading to such Vata Pitta issue. Next, please. Cervical spondylitis, as I explained you, in the vertebral column, the loss of space and the disc in between the vertebral column, they degenerate, and that is leading to the pain in the neck region. And the pain can also radiate, and there can be morning stiffness. Next, please. Next slide. And then coming to back pain, this is called Kati Vata. Kati is the pelvic area. And there is low back pain, muscle weakness, numbness, and tingling in the leg. And again, the disc space is reduced. So in all the cases you have seen, the disc space is reduced. The inflammation is there in between the bones. That is leading to such joint pains. Next, please. There is one activity of humans which is contagious. Do you know what is that, Alexander?
I presume it's just walking. It's a straight position of our body.
No, this is right. That is also right. But contagious is also this when we yawn.
How it's connected with the yawn?
When we are yawning in front of somebody, the other person also feels like yawning, and it spreads in the room, and everybody's yawning, and everybody feels sleepy.
Indeed, it's like the signal for the whole bunch of people to go to sleep. But it's not the time. We are now very active.
That's good. So let's be active. I am not able to see anybody because everybody's video is not functional. Let me see some faces. I can see.
We usually switch off the additional signals just to stay on the track.
All right. I usually am used to face-to-face conversations, and but it's okay. Once we will organize some conference or something like that, face-to-face also. So
we can do next for the Q&A, questions and answers. We can switch on cameras if you prefer to.
That will be good. Okay, so coming back to the topic, because there are certain exercises I would like everybody to do with me, but that is possible only when we do a seminar, face-to-face seminar somewhere in Europe in future. We can plan that too. Okay, coming back to this issue of osteoporosis. So as I told you, the weakness of the bones. Porosis means the bones, they become porous, weak, and there is not enough calcium or phosphorus to hold the cells together and make them strong. So the weak bones, slowly, the bones with the age, they are depleting, the calcium is going out, the phosphorus is going out, and that is leading to bone weakness. And how this is happening, especially in women after the menopause, this estrogen is falling down. So lack of estrogen causes the weakness of the bones, especially in women. And that's why, and also in old age, the women sometimes they lose so much of calcium and phosphorus they fall and then they break their femur, the thigh bone. So that leads to more complications. So it is very important to maintain the bone mineral density. The minerals in the bones, they are calcium and phosphorus. So it is very important to maintain their density by nutritious diet, by exercising, and also taking care of levels of vitamin D in the blood. So next, please. So this, as we discussed, extra extra growth in the heel bone due to calcium deposition. If there is too much of calcium, or if there is calcium metabolism imbalance, that can lead to this bony spurs in different parts, especially in the heel, causing the pain. Next, please. Next slide. This we discussed already, is autoimmune disorder, especially affecting the men. Next, please. The spine becomes stiff and just like bamboo. And other symptoms of this ankylosing spondylitis is inflammation of the eyes, inflammation in the lower back, and also tendons. So this can also be corrected. Next, next, please. Yes, as we were discussing, it is inflammation of the capsule called capsulitis. So adhesive capsulitis. It is like, just imagine some gum or glue is inside your shoulder joint. If some glue is there inside the shoulder joint, what do? We try to melt the glue. How do we melt the glue? By rubbing it, by massaging it, by exercising, by creating some heat in shoulder joint so that it can melt the glue. So it is capsulitis. We also, as you know, itis means inflammation. So we need to use anti-inflammatory herbs also, which are natural. I don't like these allopathic modern anti-inflammatory drugs like ibuprofen or certain things, because they can cause more gastritis or acidity or gastric ulcers and other issues also. Simple herbs like turmeric and ginger and boswellia and gugul, such herbs, they are very, very useful, natural, very strong anti-inflammatory herbs. Next, they can, all these herbs, they are very powerful painkillers also, without causing any damage to the body. So fibromyalgia, another painful condition when the patient is usually a woman, the whole body is affected, and the muscles are mainly affected. It is not affecting the bones, but mainly the muscles and the soft tissues. The patient is always complaining of fatigue and severe pain in the body, everywhere, all the joints. So this is also related to Amavata, according to Ayurveda. In modern medicine, doctors, they use magnesium, calcium, phosphorus, all such muscle relaxants, painkillers, but still uh, the patient, they don't get healed. They are complaining for years and years. But with Ayurveda, it really helps. Next, please. Sciatica. As I told you, the nerves coming from the lumbar region or the region of the spine, they get compressed because of pressure in the lumbosacral area, and stuck in between the vertebral columns because of degeneration of the disc or prolapse of the disc. That is compressing this big nerve called sciatic nerve, and this sciatic nerve is irritated and leads to a lot of pain, which is going towards the leg or foot. Next. So now we discussed already how we can maintain joint health. Healthy weight is very important. People, they don't know how to maintain their weight. They read a lot, they study a lot, they know they should restrict some calories, but they are not able to restrict the calories. Although I have seen in Europe, people are not so obese as compared to USA and as compared to India, but because of the salads they consume, I have seen most of the people in Europe not so unhealthy, still healthy, maintaining the weight they are exercising. But in America, it's terrible situation. In Canada, is bad, and in India also getting very bad. So it is very important to maintain the weight. So just skip one meal and consume more salads during, and or reduce the portion of the meal and consume more salads. That is the mantra. And cut down sugars, cut down bakery, and cut down cakes. And the cakes are a weakness in Europe, as I have seen cakes and pastries. So cut down on these sweets, chocolates also. Cut down on chocolates, cut down on paste, and maintain a healthy weight, and then you can get rid of the joint pains. Avoid this sugar addiction. Stay active, maintain correct posture, get enough calcium and vitamin D, and avoid injuries. Okay, this is another reason why people they are having joint issues. Too much sports is also cause in Europe. People are playing a lot and then undergoing a lot of injuries. So next, please. So this, as I told you, anything which is growing on the trees, on the coming out from the earth, the food which is coming out from the earth, or the food which is growing on the trees, that is good for health. And the food which is made in the factory, that is not good for health. But still people don't understand. I don't know why they are not able to control their tongue, because the tongue is looking for taste. All the time we are consuming cakes, pastries, and these fast food and refined grains, French fries. So these foods, we have to give our energy to get rid of these foods, these toxins. We provide our minerals. Our bones, they struggle very hard. They give our minerals to get rid of these foods or this junk. So next, please. Okay, this is very important food. Omega-3 fatty acids, they are very important to stop inflammation and also help in maintaining this fluid around the joint or around our organs. All our organs like heart, our lungs, our eyes, our joints, they are surrounded by a fluid. So this fluid is made of fats. So these fats are not the saturated fats, but mainly these omega-3 fats. Our brain is also made from fats. So fats are very important for our health, our joint health also. So consuming these natural fats, especially the oils, that is very important. Especially this flaxseed oil. So sometimes people they consume these flax seeds as it is, but they are passed out of the gut without digestion. So it is better to slightly crush them or chew them rather than ingesting them as it is, or take some oil of flax seeds. Next, please. Yeah, this cow ghee is called nectar of life in Ayurveda. It's wonderful. It is calming. It is calming down the Vata. It is rich in omega-3 and also a good combination of omega-3 and omega-6 and omega-9. So these is balancing the tri-energies, Vata and Pitta, and especially Pitta. So cow ghee can be consumed to maintain healthy joints. Next. It also helps to absorb vitamin D. The oils which we are talking about, they help to absorb vitamin D. So it's very important to consume these oils. Next slide, please. Yes, if you look at the walnuts, they resemble the brain. So they look like brain because they are actually helping in depression, to get rid of depression and sadness. They're full of natural serotonin. So serotonin levels, they decrease in depression. So whenever we eat these walnuts, they increase serotonin levels and people, they become happier. So if you're happy, then the joints will also become happy. Then you would like to exercise. So it gets rid of depression and sadness and also prevent this inflammation. Next. Chia seed also rich in omega 3s, helps in joint lubrication. All the seeds, they are excellent for joint health. Next. Next, please. Okay, cheese. So this is a controversial thing because too much consumption of cheese can lead to too much fats in the liver. But cheese is also rich source of calcium and proteins. So proteins are also very important. So if it is healthy cheese, naturally made, not no chemicals in the cheese, then it is okay. So you can consume. But nowadays, a lot of negative publicity or negativity about these dairy products, because in Ayurveda, dairy products are not considered bad. Ayurveda, it says they are improving the life quality, they are nourishing, but because of adulteration and hormones and such antibiotics, these things can be problematic. But you have to be careful about the source. If it is natural, if it is trustworthy, then cheese can be very useful for your bone health. Next. Okay, this is a golden herb. Because it looks like gold, it is actually gold. It is nature's very powerful herb. It is anti-inflammatory, antiseptic, antibiotic, antidiabetic, antiviral, so many antis. So it is pro-life. It is enhancing life, preventing all oxidative stress and inflammation, and also anti-pain. So analgesic, very strong analgesic. In India, if somebody falls down from some stairs, or if somebody meets an accident on the road, also if some injury is there, serious injury is there, broken bones or whatever, or inflamed muscles, they are not taken to hospital. They are first given this milk boiled with this turmeric, this wonderful herb. So we feed this turmeric. Sometimes there is sprain and muscle sprain only, not a big serious injury, muscle sprain and strains, sports injuries. We just give the golden milk to the patient, and within 2-3 days, the patient becomes all right. He doesn't need anti-inflammatory painkillers or ibuprofen or certain things, and it works like ibuprofen but without causing any side effects. So we use curcumin capsules. There is active component called curcumin in this turmeric. Although turmeric has only 5 to 7% of curcumin, but still it is very powerful. So we made 95% of curcumin capsules. Always give curcumin capsules to all my patients who are suffering from joint pains or any inflammation. Okay, next, please. And these egg whites, we need albumin, we need protein. So these egg whites, they are rich in collagen, building amino acids. So it is very important to support the cartilage healing, and whenever there is inflammation or whenever, basically we need raw material to heal the injured joint, or the inflammation of the joint. So for that purpose, we need protein. So that's why I have included protein. But to burn protein, you need to do exercise and also drink enough water so that you can balance it. Next, please. So you need a lot of antioxidants also to reduce inflammation, to get rid of so many toxins in the body. Stress leads to a lot of imbalance of our doshas. So the richest source of antioxidant in the world, they are these blueberries and other berries. So berries are must to be consumed every day to prevent all the diseases. Next, please. Okay, ginger is another anti-inflammatory herb. In Ayurveda, it is called, there is a name called Vishv Bheshaj. the medicine for the whole world, because it is available around the world and it is very powerful. It is strong anti-inflammatory, just like turmeric, and it also supports collagen production. So it's wonderful. Ginger tea must be consumed every day if you are having joint issues. Next, please. Okay, now coming back to these dairy products. This milk in Ayurveda, ojas is a terminology. Ojas is a terminology given to the crux of all our immunity. When we eat any food, the juice of the food becomes the blood of our body, then becomes the tissues, then becomes the muscles, then becomes the bone and the bone marrow. So after the bone marrow, there is formation of reproductive tissues, and then there is the crux of all these tissues is immunity, and this directly feeds the immunity. This is so powerful. The milk is considered just like ojas, but it has to be pure, and the source must be very good. So milk products must be given if they are sourced from a good place. Okay, next. All right, this leafy greens, a lot of calcium, lot of phosphorus, lot of minerals, antioxidants, magnesium. It is called green blood also. These green leafies, they are full of natural calcium. All the animals, they are not drinking milk, they are living on these greens. So if somebody is vegan, doesn't want, if he feels milk is heavy on his stomach or lactose intolerance or something like that, then they can every day consume juice of this coriander or celery juice every day, around 40 to 50 ml. So to support the calcium requirement in the body. Next, seeds full of calcium, full of phosphorus, full of natural nutritional vitamins and minerals must be consumed. So we know all these things. All the people I know, they are very health conscious. That's why they are attending my seminar. They know that these things are important. These uh, are available everywhere and they are consuming it. But along with that, they are not following certain law of health, not living happily, a lot of stress, not sleeping in time, lot of carbohydrate intake, lot of sugar intake, so alcohol intake, heavy food intake, even after 7 p.m. or 7:30 p.m. should be the last meal, but still consuming a lot of food after 7:30. So sleeping late at night, not getting disciplined in life. So all these things lead to stress and inflammation. Okay, figs. These are natural things which I have told you. Anything growing on the trees must be consumed, but these dry fruits, they are excellent source of minerals and vitamins. Next, please. Okay, so we have some supplements. I have made these supplements. Even the capsule shells I have made natural, and I have not added any colors to the capsule shells because some companies they put some colors to make them not transparent so that nobody can see what is inside. So my capsules they are transparent so that anybody can see what is inside. If there is moisture or if there is something else, so I have not added some chemicals inside the ingredients. No, nothing to stop the moisture, nothing to change any color or anything, not to make it good looking. But the capsules are very nice, beautiful, and transparent. So the ingredients are 100% natural. So I'm using all these herbs, and I am making the using the vegetarian capsule made from plant cellulose, and also improving the best quality herbs and making their extract to improving their strength. So this is something jointed plus. I gave it to a horse in USA. I remember in 2007. I have a video also on YouTube. The horse was not able to walk. The joint was severely damaged. Osteoarthritis was there, and the veterinary doctor was giving these injections, steroid injections in the joint. And the doctor gave up. He said he cannot walk. At that time, the horse was about 7 years of age, and the doctors gave up. I gave only jointed plus in 2007 to a horse in USA, and that horse is now about 27 years of age, 28. Maybe now it is 29. So he's still running after 20 years. So this worked within 1 week. He was able to walk. So these herbs, they are powerful. Boswellia is very powerful. Curcumin is powerful. And next slide, please. Let's see. Okay, we discussed about omega importance of omega-3 fatty acids. You can take it from the diet also, but if you are traveling and if you are not able to somehow take from the diet, you can take this omega flow and carry it with you while you are traveling, or give it to the elderly to support the diet. Next. In that, I also put grape seeds because full of antioxidants. So now this one, the roots of this shatavari and this hadjod, the third herb, everybody knows about the first herb called Vidania somnifera or ashwagandha. Ashwagandha, very powerful, just like a horse. It can give you strength of a horse, ashwagandha. The second herb, shatavari. Shatavari is a root which is full of protein, full of natural antioxidant, full of nutritional calcium and phosphorus, very good for the bones. And hadjod, third herb, I am fan of this third herb. This is even if you look at it, it looks like joints, just like walnuts. They look like brain. This cissus quadrangularis, it looks like some joints. So it is helping in osteoarthritis as well as osteoporosis to improve the bone mineral density. So, and Arjuna is also healing for the joints, healing for it reduces the stiffness and the pain. Okay. So next one is this joint 8 plus. I'm using Boswellia, this Vitex Nigundo, Gugul. I am seeing all these trees or these plants every day, and I'm speaking with them. I have grown them in my garden in front of my house, inside my house. All these herbs, they are growing for my hobby's sake. I have planted each one of them, and I see them, touch them, feel them almost every day, and I talk to them, and I thank them for being there to help the people of the world, and I love them. So I want all of you also to love these natural plants around you. Yesterday there was somebody in Slovakia saying suffering from flu, and then I told her to consume this big tree which is growing there in front of her home. I knew it is growing there, so I told her just take the leaves and make the decoction, and you will be free within 1 day. So, and I know she will be fine. Similarly, these plants, they are so powerful, they can help you without any use of modern drugs or such complicated and fancy procedures of testing and so many things. These simple herbs, they can help a lot. So I have used my expertise. I was doing MD in herbal pharmacology like 25 years ago, and I was seeing the plants growing and I was studying how they can heal, and I did my research on various plants. So I learned how to make the products from those plants. And from that day onward, from last 25 years, I am seeing a lot of patients suffering from very, very complicated diseases like even cancers, tumors, blood cancers, and such joint pains getting healed, colitis. So the plants, they have too much healing power. Yesterday, I was talking with somebody. There is a plant which is showering, which is sprinkling water molecules during the hot summer days when the temperature outside is 45 degrees centigrade. It is just go under that tree. It is sprinkling. Actually, it is a transpiration process in botany. But so they know how to keep themselves calm and keep this world also calm. So my message to you is plant more plants, more trees, so that we can make it a better place. So these are the plants, Boswellia and curcumin. Boswellia curcumin, very strong painkiller, good for the inflammatory joint conditions, any kind of extra growths, tumors, cancers, and pains. Whenever there is pain, you can take it. Even shoulder pain, back pain, knee pain, any kind of joint pain. So this is just take 2 capsules 2 times a day. It will immediately help. Along with that, joint. So very good results. Next. Okay, thank you very much. I hope it is not so long. So it was. This is my office building, but now this is bigger. This is the old picture we put, but now it has become 4 times bigger. So we'll use new one very soon.
Yeah, we're waiting for this. We're expecting also maybe our listeners and our colleagues, they can join to visit the Chandigarh and the clinic of Planet Ayurveda. So Dr. Vikram can say a couple of words for that.
Yes, of course. I would like to share whatever I'm doing here, whatever miracles I'm seeing. I have put a lot of YouTube videos, interviewed a lot of my patients when they are sitting together waiting for me. And there are a lot of like 50 people waiting, and my team is interviewing them, why they are here, who told them to be here, why they have come here. So I see interesting, they put everything on record and they put it on YouTube. So I see a lot of interesting things happening from last 25 years in my clinic, and I feel so proud and happy that I am into this science of Ayurveda, the healing science of Ayurveda. So it gives me really, really, really intense happiness. So we can have some questions if somebody has any questions.
Actually, yes, we have plenty of questions. We use the built-in chat to the Zoom application, so you can send your questions. And now I'm selecting one of the questions which are connected directly to the previous mentioned products. So please explain how you check the materials for the absence of the high metals or any add-ons, because the soils in India are usually very rich in heavy metals.
Uh-huh. I didn't know that we are rich in heavy metals. I thought.
This is the opinion.
Uh-huh. All right. So this was an issue. This is an issue with a lot of Ayurvedic companies. And Ayurvedic companies, you will be surprised, they don't even know this, that this is an issue in Europe or anywhere in the world. So, but I started my company in 2000, year 2000, and then this is the first issue I addressed because I studied in my MD that this there should not be any heavy metals. Yeah, planetayurveda.ru is there. So I addressed the issue of heavy metals. I did the microbial analysis of all the products. I did the pesticide analysis, not only heavy metals, but pesticides is also a big issue. So I have made these products free from pesticides, free from heavy metals. We check the levels of heavy metals here of all our raw materials and before making the products, and even after making the products, we check the heavy metal levels. And once we export them to Europe, then in Europe also we check from the European labs. So we keep all our batches free from heavy metals. I take special care of that, and because these are the things which I need to consume also. My family needs to consume also. So the whole world, I consider my family. So I cannot intentionally give them heavy metals, or intentionally or technically also. So even here also we are consuming Ayurvedic products. Even in my own drawer, you can see this thing is Brahmi, good for memory.
Nice. Same here. This morning, one brahmi for good memory and for brain activity.
Good for brain activity. So the thing which I can consume, which my children can consume, and moreover, I am testing them. I have all the certificates, all the tests available of heavy metals. I know people in India, they don't care about heavy metals. They are the pharmacies or the manufacturers. They are not aware. Many of them, most of them, they are not aware what is this. But I am exporting to USA. I'm registering the products to other countries also, in Africa, in Southeast Asia, and Singapore, in Europe, in Canada also. We are registered in Health Canada. So heavy metal, the level of heavy metals in Europe is 10 times more than in India. So we are passing that level also. That's why we are present there. So if, for example, if the limit of some heavy metal is 10, 10 here, 10 units in India, so still allowed in India, but in Europe it is 1 unit. And we are checking our ingredients in Europe also, and we are passing those stringent tests also. So we are having no issues of heavy metals.
I believe the quality certificates like ICO or EcoCert or GMP also helps to be sure about the quality.
Well, these certificates, they are like regulatory requirements. There is a paperwork. So paperwork, many people, they can complete the paperwork, but these heavy metal thing is something related to your own consciousness, what you want to do. So this paperwork is available with so many companies. Many companies, they are GMP. Many companies, they can follow this ISO. But this is the inner thinking that we, other than maintaining all these certifications and on paper, but also we are doing in reality also, in actuality. We are following the system.
So now we can go for practical questions from our listeners, and I will unite two questions into one because it's regarding Boswellia curcumin. So what is the course? How long should we take the Boswellia curcumin? And connected question, is it Boswellia curcumin also good for prophylactic purpose?
Yes, it is. As I told you, it is powerful anti-inflammatory. It can be used if you are suffering from severe pain. You can use it for like 15, 20 days, 1 month, or sometimes 3 months, 6 months. It depends upon your condition. So it, even for 2 years, 3 years, 5 years, because it is natural, it doesn't have any side effects. It can be consumed forever. So it is depending upon the situations. But if you're having any acute injury, some sprain or some strain or some sport injury, you can consume for 1 day, 2 days, 5 days. 2 capsules 2 times a day is generally what I recommend. So for adults, 2 capsules 2 times a day is enough. Each capsule having 500 milligram of extract. And I'm always using curcumin 95% in all my products. I'm not using plain turmeric. I'm not using curcumin 10% extract or 20% extract. How, this is another ethical question, how the patients or the user will know what the pharmacy or the manufacturer has put inside. How much curcumin is there? How do you know? You trust me, that's it. Or you trust my test reports. of the product. But who is doing the test? Nobody. So only I have to do the test. They have to trust me. I have all the test also papers, but I am using 95% curcuminoids in all the curcumin based products because I know if I don't put curcumin 95%, the results will not be there. There will be very minimum results, but with 95% of curcumin, I get quick results within no time. So it works like magic for pains.
Next question, what is your position, where and from what to start the treatment of rheumatoid arthritis?
Rheumatoid arthritis, the first step is stop consuming the food which is heavy, cheesy, and greasy. So, which is too much, which is producing ama, which is heavy to digest. So, the digestive system should be good. The digestive fire should be good. So, it is called Amavata in Ayurveda. So, it is very important the patient should not have any constipation. So to avoid constipation or to correct constipation, must consume some oils like castor oil, or castor oil is considered the best for rheumatoid arthritis. So even if you have constipation or no constipation, still consume castor oil 2 to 3 tablespoonful every night to get rid of this uh, vata as well as ama. So to burn the ama, digest the ama, we give this Boswellia curcumin and jointed plus 2 capsules 2 times a day, or sometimes 3 times a day. We also have another product called Gugul, or bone support. So Gugul is also very good for the pain, but these two are good enough. Jointed plus and Boswellia curcumin, 2 capsules 2 times a day for like 3 months, 6 months time.
We can apply same recommendation for next question for the male, which more than 15 years suffering from rheumatoid arthritis. Even the knees are not that good in motion, some sounds and a lot of swelling. So all these recommendations can be applied here.
Yes, yes. All these recommendations for anybody suffering from any kind of joint pains, in osteoarthritis, lower back pain, cervical spondylitis, rheumatoid arthritis, osteoarthritis, in any pain and inflammation in any joints. So if you can, these other two products, this osteoplan as well as this omega 369, I have added just for support, just for improving the health of the joint. But the other two products, this Boswellia curcumin and Jointed Plus, they are very quick to stop the pain. So they are natural, without causing any side effects, free from heavy metals. So you can consume them without any stress. If you need any certifications, we have all the certification from EU labs, from Indian labs. So it's not a problem.
The next question is how long is the course of treatment of osteoporosis of the knee joint?
Yes, for osteoporosis, at least 6 months. This osteoplan should be consumed morning to evening to replenish the bones. 6 months to 1 year, because it takes a lot of time, and there are a lot of factors also. Stress, avoid stress, consume a lot of water, consume enough calcium, enough greens, and also vitamin D. So it's a process. So exercise. So these herbs are a very important aspect to that. So you can consume for 6 months to 1 year.
And another question from our colleague from Finland, from Ms. Tarja. You mentioned some Ayurveda treatment center in some countries. Where is it, and how to get access to visit them? Maybe you have input about your new building?
What kind of treatment center you are looking for?
So usually in Europe, the understanding of treatment, it's some applications or panchakarma or something like this.
We are setting up a Panchkarma center in our own building in Chandigarh. So we will come up with the Panchkarma center at Planet Ayurveda in Chandigarh. So people can come and stay here and we can do the Panchkarma. But there are a lot of Ayurvedic centers around the world. You can Google them, you can check their feedbacks and testimonials over YouTube, their genuinity, their pricing, because sometimes the pricing can be very, very high. So, so you can check. We also set up a center in Macedonia, but because the pricing was not easily affordable in Macedonia to people, because we were using very pure oils. So we are now having only clinic there. So, but the center setup is still there. So in near future, we will plan to set up a center there in Europe also. But meanwhile, in Kerala, there are certain centers. You can Google them, and also expensive centers in Europe. But I would like to make a very reasonable and affordable center myself in Chandigarh, in my premises.
Great to know, because we, as years before, we inviting our clients, our colleagues to visit Chandigarh, to visit Planet Ayurveda clinic, and we will share the information about that on our Telegram channels, which we are asking you to subscribe. And also you can find this information on the websites in corresponding countries. And maybe
We have launched some Ayurveda oils also. We already have Ayurveda oils from last 25 years, but we recently launched Ayurveda oils in Europe also, in Slovakia. So slowly they will be available in other countries also. You can do your own procedures like simple massages. For example, for osteoarthritis, you don't need to do so many complicated procedures, just very basic things. So you can do the massage over knees with those oils, and Janubasti also can be done at home. So certain procedures you can learn yourself and you can perform.
It's now a very practical question about rheumatoid arthritis. If you prescribe your products like Rumagin 5, stress support, Boswellia curcumin, in which order to use them?
Oh, there is no specific order. You can consume all of them together. It's like food. So it's not like that. It's like not like allopathic pills. Like this is for BP, this is for sugar. Just consume all of them together. Not a problem.
And if joint 8 plus is not available on particular market, what we can suggest instead?
We have Google available.
Yes.
Google is a replacement of joint 8 plus. So Google can be given.
Okay. And what is the right way to consume the ashwagandha?
Yes, ashwagandha is also can be combined with Google. So it is also very strong for pain, for inflammation. It's most powerful. And we have, I think, in the name of Gugu lipid also, because Google has one effect on the joint pains and another effect on the lipids also. So in cholesterol also, so for heart also, to cleaning the arteries also. So Google lipid can also be given. So what is the question you asked me?
So it's actually connected question. What is the difference between Google and Google lipid? But you already answered.
Yeah, it's no difference, because we are using the same herb with different name. So it is also working for the lipids.
And another question, very much European one. To which kind of milk should we add curcuma? To the very hot or to the warm?
This is an interesting question. We can just take one glass of milk, like 150 ml, 200 ml of milk, and just add 50 ml of water. 200 ml of milk, 50 ml of water. Just put some curcuma, tablespoonful of curcuma, teaspoonful 3 to 6 grams of turmeric powder, and then boil it, and boil it like a full boil. And when the water evaporates, water is evaporated, then the milk remains about 150 ml. Then you can strain that milk and then you can drink it. So it is very hot, but it is very good.
And from our colleague from Germany, who is a professional masseur, she asking, did you know anything about application of the oil to the belly region? Because there is information that is connected with the pain in the knees.
Yes, very much right. In Ayurveda, it is called the belly button is called the connection to the whole body. So it is working for the for the whole body, because when the belly button is formed in the embryo, or in the when we are babies, it is a supply route for nutrition, and all the nerves, all the feelings and the emotions from the nerves, all the layers of endoderm, ectoderm, mesoderm, our whole body is made from that area. So the whole body is having a connection. All the layers of our endoderm, mesoderm, and ectoderm of our body tissues, they are connected to this belly button. So if we massage the belly button, we are nourishing the whole body. We are nourishing the all the tissues. Rasa, Rakta, Mas, Med, Asthi, Majja, Shukra, all the 7 tissues and immunity, they are nourished if we are putting this oil on the belly button. So Ayurveda has a lot of importance by putting the oil on the belly button. And I would like to add from my side, if you are making turmeric milk, you can also open up this capsule, Boswellia curcumin capsules, and boil the ingredients in the same milk, and you will see it has become more powerful.
But before we go, for the next seminars, we soon open the vote in our Telegram and WhatsApp channels. So please be actively involved in the selection of the next topics. I remind you, because all these previous topics were selected by our audience. So maybe some closing word before we go, Dr. Vikram.
So thank you to all my audience, and also to you, Alexander. And I see Alina also there from Latvia. Thank you to Alina also. She has been a wonderful promoter or a supporter of Planet Ayurveda in Latvia, and helping Planet Ayurveda everywhere. And also Damayanti, who is organizing this, and also to Alex and all the participants. And this event should be useful if you practically use the advices which I have given you, especially regarding your diet, regarding the lifestyle, regarding the changes you can make in your food habits. Then only there is the purpose of this conference or this seminar, this meeting will be solved. So it is very important to take care of your health. You can never have joint pains. You can never have osteoporosis. And that is true. You can never have rheumatoid arthritis or any other health problem. Our body is meant to last for 100 years without any medicines. So medicine-free living is what I believe in. It is possible by controlling your emotions, feelings, or not controlling, just managing or harmonizing with nature. So that is the message of Planet Ayurveda. I want to spread this Ayurveda science all over the planet. That's why I named it as Planet Ayurveda. It's beautiful. Similarly, I expect the same from you. And now I see 50 participants here. So next time, I would like to see 100 participants. I hope you will inform others also. We will come up and cover another interesting topic. Thank you very much.
Yes. Indeed, this time we have the absolute record of the online participants. It was 62. And I want to express my gratitude for the all team involved in preparation of this event. It's the Dr. Vikram himself and Mohali team, our clinic in Planet Ayurveda in India, our Planet Ayurveda Russia team, Dementi and Natalia, of course, our brilliant translator, Alina, and myself, Alexander Laktionov, say you goodbye and see you next time, I believe, in March 2025.
Thank you. Namaste.
लिवर, किडनी, लंग्स, स्किन, दिल, पेट, घुटने, सिर, पैर या बॉडी के किसी भी पार्ट से जुड़ी हो कोई भी समस्या अभी कॉल या व्हाट्सएप करें और घर बैठे समाधान पाएं 6209123456 पर। हाँ जी, अब सब बीमारियों का इलाज है बहुत आसान। आपकी सेहत से जुड़ी हर समस्या का समाधान मिल रहा है घर बैठे। अब आप दुनिया के किसी भी कोने से टॉप प्लैनेट आयुर्वेदा एक्सपर्ट से ऑनलाइन बात करें, परामर्श लें और दवा की भी करवाएं होम डिलीवरी। हेल्थ प्रॉब्लम्स कोई भी हो, सोल्यूशन सिर्फ एक, www.planetayurveda.com। पूरे प्लैनेट की सेहत का नंबर 1 साथी।